Hi and welcome back here to my YouTube channel. Today we're going to have a little practice or 3 exercises you can do for a very common joint that is often irritated, and I'm talking about the iliosacral joint. Why this is important to me is I'm a yoga teacher and an osteopath. I'm not just treating manually on the treatment bench, I'm teaching yoga, and this is again an area that is often in pain or often causes pain for students as well as patients, and it is an important part of our body because the iliosacral joint is the connection between the pelvic and the spine. So dysfunctions coming from your feet, your legs, your ankles, your knees, the whole leg axis, especially or as well as pelvic tilts, can cause this dysfunction for the ligaments and this joint not be articulated so well. But the same but the same stands for having visceral digestive problems, scars after surgeries. All these things can cause your pelvic to move, to tilt, and tension to arise in that little joint that, like I said, is the problem of so many. So we are going to, if you like the video today, make sure you subscribe and like. It's a huge support. And I'm going to support your iliosacral joint now with my 3 favorite movements. So first of all, come down onto your mat. And the first movement I have shown to many, I want to say hundreds of patients, and is a practice that has helped myself a lot. So you come down laying, and can be done even in moments of pain. You come into a laying position and you just start moving your legs from your hip down. So as if you would step up and down without bending your knees and start moving. And do slowly, because this can be sometimes be a bit painful, or or you will feel sort of the misaligned iliosacral joint. So do this for a while. And I have shown this movement a lot because it can also be done in a standing position as you lift up and down. When you do it standing, it's really good for after to also be able to sort of swing your leg. And then make sure to always do it on the other side. It's a joint we have on each side of the sacrum. So we're lifting and lowering, and we swinging. Then, but this wasn't the second one. This is just few variations of this one particular movement. As we then come into a four-legged position, this is number 2. This is also moving the ilia, the pelvic, and the iliosacral joint by lifting now your knee off the mat, just a few centimeters, and down. Also here you can place a block underneath your knees, but you don't need to do massive movements. It doesn't need to be 10 centimeters. It just needs to be that little directed movement into this joint. We're doing the other side. And then coming back to the left side, we're lifting the leg up, same lift, but we're holding. And now we're taking our right hand on the outside of the left thigh, and we building pressure. The knee is pressing out, the hand is holding and stopping the pressure. So it's counteracting, hold this and release, change sides again. Bringing the right hand on the outside of the left hand on the outside of your right thigh. Push, the hand holds and release. Make sure to, in between, put a few cat and cows. And as often an iliosacral dysfunction or pain comes with tight glute muscles, piriformis. Put your left foot, stand it up in the same line of your right knee, having it face outwards. And even here, keep going with your cat-cow. Sit back a little bit and give your glute and back buttocks a good stretch. Then change to the other side. You can start feeling into this region with some cat-cows going there, coming forward, and then slowly sitting back and breathing. And then slowly release. And the last one is you lay on your side, because this is a movement that is often a little bit forgotten in the pelvic. The ilia wants to be moved in an outer rotation, and therefore we're using the little muscle movement, keeping your feet together, just lifting the knee. These are all simple techniques for you to have something to do when maybe a big practice isn't possible, or there is some activated tension and you just feel only resting isn't the way. And this is what I want to show you here on this channel. You can use movements to release, help yourself, and remember to, first of all, also do the other side. But remember that the worst thing you can do, especially when it's about the musculoskeletal system, is to not move at all and let the tension take over and let the blood flow decrease and everything's tightening up. Just bring a little circulation there. Okay, and once you've done this on both sides, allow yourself to roll back onto your back. Keep your feet standing and just rest for a moment and let that impulse and the stimulation you placed into your pelvic area, into your iliosacral joint, let that impulse arrive and settle. And so I hope, like I said, this was beneficial to you, especially as in our yoga practice, we're working a lot with the pelvic itself, the stabilization, the fundament. And therefore it's super important to have that fundament, to have a feeling of fundament and strength, to also work with it mentally. And this is very important too. That's the body and mind. They are not disconnected. They all belong together. And therefore I hope this was of help for you. Thank you very much.